Over the next several months, or really for as long as it takes, we are committing to stories that bring awareness to some staggering statistics with the hope of saving lives and communities. Now, it's something that's very personal to me. Fact, black men suffer worse health than any other racial group in America. Black men also have the lowest life expectancy and the highest death rates compared to both men and women of other racial and ethnic groups. While there are several reasons that contribute to this, the biggest factor is large numbers of black men simply do not go to the doctor for primary or preliminary care. So I want to start right there. The importance of primary care, regardless of race or ethnicity.
My father died from cancer, and I don't know all the details. I was younger when it happened. Could screening have caught it or prevented his early death? But that it certainly is what inspired me to go into medicine, without a doubt.
Our expert with a personal stake in the importance of primary care is Dr. Madison Ryle, who practices internal medicine and pediatrics with Norton Healthcare in Shepherdsville.
The importance of having a primary care physician is having a relationship with someone that you trust.
Dr. Ryle is also my personal physician.
If you have a relationship with a primary care doctor, you can catch a lot of those things. You can catch the diabetes, you can catch the high blood pressure, you can catch cancer in early stages and change those outcomes.
Dr. Ryle says, and statistics show, far too many people wait until they're sick or in crisis to see a doctor. And that alone can lead to life-threatening or life-ending outcomes.
If you can catch things like high blood pressure early, you can prevent poor outcomes later. When you start having symptoms from diabetes, when you start having symptoms from high blood pressure or cancer, there's a lot of damage already done and a lot of disability that can come from that.
Primary care doctors screen for high blood pressure, different cancers, heart disease, diabetes, kidney disease, hypertension, and the list goes on. I referenced these specifically because they, along with strokes, are the top killers of black men who, even when barriers like insurance and access to health care don't exist, still often avoid primary care. That inaction can be the equivalent of a self-imposed death sentence.
Unfortunately, when we look at the prevalence of, for instance, kidney failure, it is strikingly different in African American, specifically African American males, compared to their white counterparts. And the causes of kidney disease in America are diabetes, high blood pressure, amongst other things. But those are the two of the biggest. And those are modifiable things. Those are things that if caught and treated early, you can prevent those poor outcomes.
All right, I am not naive here. I know there are barriers to healthcare for many people, from cost to access, insurance, and some simply have trust issues. I know that. But if the effort and desire are there, those barriers are removable. So as we move through this effort, we're going to look at some of the resources that are available to help ensure access to primary care right here in our community. In the meantime, if you've not seen a primary care doctor in a while, it is my hope that you will make an appointment because you are worth it. One way to find one is by visiting nortonhealthcare.com/location/Norton Primary Care. And one of the things that's happened, Haley, in putting these stories together is a lot of people have said, well, it's not just black men. Men in general, or people in general, don't seek out primary care. And that's true, of course. But the health outcomes for black men are vastly different. And we're going to dive into some of that tomorrow and some of the reasons why black men in particular are not seeing primary care doctors.
We touched on this in the last hour, but this is something that you are so passionate about, that you have taken upon yourself to really bear the burden of getting these stories out there, because I know that it can be difficult for someone like you who has had those health struggles before.
And I've had health struggles, and that's why I'm so aggressive about primary care. And the amount of men in my family who have died from illnesses that have been preventable, and members of my family, they were fully insured. They had access to health care, but they chose not to go. It's hard to say that because it almost sounds like you're blaming someone, but we can save people here.
Yes.
It's preventable.